And now we cross over to our Oceang for global insight and an in-depth look at important developments in world affairs.
Thank you, Morgan. It's time for Global Insight, where we speak to experts from around the world to hear their views on issues making headlines. We began the year of 2022 with high hopes that the new year would be the year that the worst of the COVID-19 would finally end, turning from pandemic to endemic. But do we have enough reason to be hopeful? While authorities continue to roll out vaccines and approve treatments for COVID-19, we're continuing to see the new variants emerge and even evade the full effect of vaccines. And despite national plans to live with the virus, the numbers of the critically ill and fatalities are not slowing significantly. To discuss what 2022 might have for the world in the third year of the pandemic, we turn to Dr. Arirang, an award-winning American public health scientist who is currently a senior fellow at the Federation of American Scientists, based in Washington, D.C. He's known globally and was recognized by NY magazine as one of the earliest to alert the world of the potential pandemic 2 years ago, back in January 2020. And now he's advising many governments, leaders and organizations and is a key figure in the global fight against the virus. Very warm welcome to you. It's lovely to see you again, Dr. Fagleding.
Thank you.
And well, first of all, we're hearing many people are hopeful that 2022 will mark the transition from the COVID-19 going from a pandemic to an endemic. So what would that actually mean for a pandemic to become an endemic?
Thanks for having me. That's a very good question, but the problem is we have lots of hopes that it will become endemic. We thought that we were at herd immunity many times, and many times people have said, well, that was the last COVID wave. We will not have it again. Then last winter hit, and then we will not be hit with another wave, and then Delta variant hit, and then of course Omicron variant hit. So every time we've had high hopes that this is the end, it hasn't been, because we've had basically speed bumps and very loose mitigations in most countries of the world. We are basically, our strategy in this world is sandbagging whenever the flood has already arrived, as opposed to building a seawall. So I'm hopeful that after Omicron, that COVID will be very, very slow to rise again. But all it takes is one new variant, perhaps a COVID-22, that resets the clock. And this is why we have to build the seawall of not just vaccines, but also N95 masks, as well as ventilation, air disinfection standards indoors in all schools, workplaces, and public buildings and restaurants. Or else, I don't think hoping for an endemic virus, which still hospitalizes a lot of people and causes long COVID in 10 to 30% of people, is a good idea. This is not a future in which we want, because we will be paying the price of long COVID for years, if not decades to come. The best way is to stop the virus and stop transmission, not just hoping to keep the hospital beds open.
Well, last year, some governments declared a policy of living with the virus and thought that would be the end of the matter. But how do you think that's been working out? I mean, at what point could or should the government decide to stop regulating the spread of the virus?
Well, we've been saying, we'll just need to live with the virus. But we've lived with the virus ever since we've had vaccines, and people let down their guards and say, well, you don't need to mask anymore. Then, of course, we were taught a very harsh lesson with the Delta variant, which was twice as contagious, much more severe, and also to some degree immunity penetrant. And now Omicron is much more penetrant. This live with the virus only works if you assume that we will not have another variant pop up after Omicron. And that, after several waves, probably the world's going through its fourth or fifth wave at this moment, is not a plan that we should bank on. It is a very, very risky plan. It's the most politically convenient plan, economically convenient plan. But, I think we're sometimes a little bit too short-sighted with our quarterly earnings in terms of our economic planning, as opposed to long-term economic planning of preventing the long COVID brain damage, the organ damage, the kidney, diabetes that COVID causes potentially, and many other neurological disorders. That will cause much more economic damage in the long run. And so the best way to stop that is to stop and slow transmission, not just stop and slow hospitalization. And too many governments have taken we're just going to stop and slow hospitalization to the detriment of many kids and many adults who will suffer long COVID for many years to come, which is, again, 10 to 30% of the population who are infected, not even hospitalized.
Well, we are very worried that there'll be another variant coming after Omicron. And, well, you've recently been talking about the B1642 that was spotted in France. How much do epidemiologists currently know about this variant?
I think that variant is still just emerging. I'm not sure if that will become the next big one. It has some bad signs, but I think what will really, really challenge us is something in 6 months from now, when all the people who were infected with Omicron will have waning immunity. And when the waning immunity hits, I think we'll potentially have another wave if we don't have preparations in place in the next 6 months. I'm not worried for the immediate future. I think the Omicron will pass, and I don't think there's any other variant that will surpass Omicron in the near future. But once our waning immunity hits, whether from previous infection or vaccines, that's when things are going to worry. Because I hate to say it, the boosters are good, but we need better vaccines, adapted vaccines. And even the boosters are already waning. We've seen that after about 3 months, boosters wane to 45% efficacy in many studies in the UK. So we need other strategies for whenever the inevitable time comes in 6 months, when potentially there's a new variant and the waning immunity will not protect us as much as it does now. This is why I'm saying we need to stop sandbagging once the flood comes. We need to build a high seawall against the future floods now. And governments that fail to heed that advice will see economic chaos and turmoil and disruption that if we only realize investing in prevention now will actually pay off in the long run. And we need good leadership, and because this is a pandemic of not just a virus, but also failed leadership in many countries.
Well, it's widely assumed that Omicron is more transmissible, at the same time milder, and that in general more transmissible variants tend to be less fatal. Would you say this is true?
That's not always true. It's true that a virus wants to be more transmissible, but what makes a virus more transmissible usually is its ability to have a higher viral load. And that is, unfortunately, higher viral load also keep the severity up. So there's an evolutionary pressure to also higher severity because of you wants to have higher viral load and transmission. Omicron is very transmissible, and I think the mild message has been misleading because it's intrinsically not that much milder. It just seems milder because we have so many people vaccinated and previously infected. And those who are reinfected and have breakthroughs obviously have much more milder illness. But I think intrinsically it's not much milder. And remember, we're comparing to Delta. Delta is already 2 to 3 times more severe than the Wuhan strain. So if it's milder, it's still never going to be milder than what the original strain was. And I think people forget that. We have vaccines and whatnot. And if it's just half as mild, remember this virus doubles every 2 to 3 days. Any gain from being milder is quickly lost within 2 days, because 2 days is just doubling. The exponential rise in higher cases will ultimately send more people to the hospital, more people long COVID, and more people to die. And that is where people don't understand that math. A little bit milder does not save you when Omicron is potentially 4 to 6 times more contagious than Delta, and potentially over 10 times more contagious than Wuhan. And if that is truly the case, then it really comes down to stopping transmission, not just stopping hospitalization or relying on that it's quote unquote milder.
Well, many countries, including South Korea, New Zealand, the UK, they're seeing hospitals just filling up, and they're still short on capacity, of course. And so it does seem that even with Omicron believed to be milder by some, it's definitely taking its toll, and it's continuing to put a great strain on the medical system. Well, the governments everywhere, they seem like they seem quite at loss on what to do. So what they seem to be doing right now is just urging people to get more and more booster shots. But AstraZeneca said this week that you can't have people vaccinated every 6 months. But some governments, like the Israeli government, they're making it required to get. Sorry, not required, but they've started 4-shot campaigns, and the South Korean government has been discussing the idea. Would you say this is entirely necessary?
Well, I think, to be honest, 3 shots, the 3rd shot is the most important shot. That's proven. The 3rd shot gives you more protection than your 2 previous shots combined. But we do see some benefits with the 4th shot, and we do see waning efficacy with a booster shot. This is why many governments who take the vaccine-only approach, vaccines work, boosters work, but taking the vaccines-only approach is not a long-term solution. We need to focus on other mitigations, such as, again, premium masks, ventilation and air disinfection, indoor air quality. Those are much more robust and agnostic of the variant. And I think boosters, we also need a cheaper way of developing variant-adapted boosters, because right now all the boosters we're giving is still the Wuhan 1.0 virus boosters. We need Omicron-adapted boosters because the Omicron is just so different. And we need cheaper vaccines, not these vaccines that are $10 to $20 a shot. We need vaccines that are $1 a shot. And they are in development. And I think in the next year, we'll hopefully see a lot more results of these Omicron adaptive variant boosters. I think that will be much better than just boosting with the Wuhan 1.0 vaccine alone. I think in the meantime, we need to build that high seawall of ventilation, air disinfection, and premium masks in addition to vaccines. And of course, testing is at the cornerstone, and testing needs to be less than $1 each instead of, $20 or $30 in many countries right now. That's inaccessible. We need to build a high seawall now and not just rely on vaccine-only approach, because that's only as good until as the next variant. We need these variant agnostic, variant impervious mitigations.
According to our World data, only 8.5% of people in low-income countries have received at least 1 dose of the vaccine. And that means 8 out of 10 countries on the International Rescue Committee's emergency watch list they're still less than 5% inoculated. So what do new variants mean for the largely unvaccinated populations in the world? And what are currently the biggest challenges to vaccine equity?
Yeah, the vaccine equity, I hate to say, is just the world has not produced enough vaccines. And the vaccines that we've produced are way too expensive. The mRNA are effective, but they're way too expensive at $10 to $20 per shot on a high volume country level purchasing. We need cheaper vaccines. And the mRNA ones are required deep freezers. That's way too tedious. We need cheaper vaccines that can be room temperature and distributed on a massive scale that is literally less than $1 or $2 a piece, that do not have cold chain or heavy cold chain freezing requirements. That is the way to vaccinate the world, not just with these $10 to $20 premium Cadillac vaccines that only the wealthy countries of the world can afford. Because we might need 2nd shot, 3rd shot, 3rd shot. And until we have be able to afford boosters for the rest of the world, we're going to be in this roller coaster for a long time. Vaccine equity is so important, but I think the solution is we need cheaper vaccines and higher production volume vaccines. And the ones we've invented so far, they work really well, but they're too expensive for the world. We really need these new ones, or else we're going to be stuck in this vaccine equity dilemma for many, many years to come.
And well, to end our interview on a more optimistic note, is there any good news that we can look forward to in the year of 2022?
Yeah, I'm very hopeful. Some of these other cheaper vaccines, these protein-based ones, they're having really hope. One is already developed from Texas Children's Center under Peter Hotez. There's other ones being developed by Dyadic that can produce even higher volumes. Literally, we can produce hundreds of more doses per dollar than any of the current vaccines, and they're very inexpensive. I think we will see a lot more innovations in the world of vaccines in this year to come. And I think hopefully that the world will wake up to make rapid testing free for all, N95 masks free for all, and this indoor air disinfection, which are relatively inexpensive. We can solve it. We can fight it, but we need good leadership and not just blasé attitude, not just relying on, let's just keep the hospital beds open, because that's not a prevention anyway. Just because hospital beds are not full does not mean that we need to neglect seatbelts or helmets or drunk driving laws. The key to public health is still prevention, not just preventing hospitalization. And I think there's still lots of great science to be done, and I think we will be able to control COVID in 2022 if we come together and solve these critical issues.
Well, we'll have to continue relying on your advice and insights, Dr. Eric Vegelding with the Federation of American Scientists. Thank you again today for your time. Thank you very much, and have a very happy New Year.
You too. Bye-bye.